But since Nick's here right now, I can show you the adjustments here. So take a nice deep breath in and all the way out. Yep.
So a little disclaimer, you really can't fix scoliosis unless it's surgical.
Yeah.
What we can do here, go ahead.
Just a little drop, yep.
Oh, beautiful.
Hey everybody, this is Dr. Brady and Dr. Nick from Kalkstein Chiropractic here in your Towson area chiropractor. And today we are going over scoliosis. And who better to do a scoliosis video here than Dr. Nick Kuhl. So Nick, tell me when you were diagnosed and a little bit of backstory here before we get started.
So I really was unaware of scoliosis until grad school. What was I? A year and a half in. We were practicing orthopedic exams in the thoracic spine. And so a part of that is the Adams sign, where you make the patient clasp their hands together and they bend forward and you're looking at the patient's back for subtle biases of left and right, whether one side of your ribs is humped a little bit more than the other. And I had just a subtle one. I was working with my professor at the time, and she was asking me if anyone had ever diagnosed me with scoliosis before, and I said no. So she wrote me a script to get a full body or a full spine x-ray at our x-ray department on campus, and they said I had scoliosis.
Okay.
Shortly
Gotcha.
after, yeah.
All right. Well, have you ever noticed like any problems, or is it pretty much asymptomatic throughout?
No, I noticed some issues. Majority of it for me, thankfully, has only been some rib stuff. So I'm pretty consistent. I get a rib out on the right. I shouldn't say rib out. I get rib head irritation on the right pretty consistently, especially if I lift improperly or move a certain way. I can definitely notice it. Very occasionally some low back discomfort, but nothing that adjustments and treatment can't manage for me.
Okay. And another thing I at least ask my patients is, like, when you look at yourself in the mirror there, do you see any of the ribs kind of popping out there on one side?
No.
Compared to the other?
Not really. I think the biggest noticeable aspect of mine is that I have maybe just subtle shoulder height discrepancy. Mm-hmm. But outside of that, nothing looks abnormal for me.
Gotcha. And then Dr. Nick was just saying he's pulling percentages out here. How many percent, roughly, it doesn't have to be an exact number, is idiopathic for scoliosis?
Yeah, most scoliosis is deemed idiopathic, meaning they don't know what the causation is. So I think the threshold right now currently is anywhere between, so the minimum cutoff is 13 degrees. So you have to have some sort of curvature of 13 or greater to be classified scoliosis. I think I fall right at that threshold. I have about 13 or 14 in the low back, and then it bows up a little bit in the thoracic, about 4 or 5 degrees, and then it evens out in the neck. So nothing too crazy, but 13 to about 25-ish is to be watched. Conservative care, stuff like that. Above 30, they typically like to start bracing, especially if you're a younger individual and you're still growing. They want to try to brace it, get it under control. Anything over, 40, 30 or 40 degrees, they start to consider surgery. Because at that point, you're starting to occlude proper sort of organs that you need. So your heart, your lungs, stuff like that starts to lose integrity, especially whenever the spine's curving as much as it does in those higher percentages. So around that time, they'll start to consider either doing rods or some other sort of stabilization to that region.
Especially with the levoscoliosis, like Nick said, with the heart there, it can definitely cause some complications there. So definitely a surgical candidate if you're kind of in that 40 to 60 range there. But also wanted to say the two most common really occurrences where scoliosis is heightened is puberty and then menopause for women. So those are the two times that we really look at scoliosis and really want to watch and monitor any changes in the degrees there.
Yeah, a little bit more prominent in the female population, naturally so. They're a little bit more flexible and mobile. So a lot of young females are prone or more commonly diagnosed with scoliosis. It typically, once you hit puberty, the literature kind of goes either way. Some literature talks about how the scoliosis is stable until menopause. Other literature says you get about a 1 degree increase each year of life during your adulthood. But the reason menopause causes an increase in scoliosis is because you have such a change in hormonal balances and you're starting to lose bone density and calcium and stuff like that. So that leads you a little bit more prone to deformation of the vertebra in your spine, increasing scoliosis.
Yeah. So yeah, I think that's a good recap of scoliosis and kind of like the history and what some things to look for here. But today I'm going to show you how we do that Adams test or Adams sign, like Dr. Nick mentioned here. So yeah, if you want to face me here,
I'll just go ahead and slide this off.
Perfect. Oh,
I don't know if you'll be able to see much.
probably not.
The shirt since
It's black.
So if you want to get directly behind me, Carly, you'll be able to maybe see it a little bit easier.
All right, so hands together, lumbar flexion all the way down, hands to your toes. Try and flatten the shirt out here. Yeah, it's kind of hard to see, but there's a little bit of raise.
Yeah, subtle on the right.
Yeah.
So.
Okay. All right, so from here, what I do for posture, I would definitely make sure the T-spine mobility is there. So I would get Dr. Nick down on the table, face down here.
And then I have to do exercises.
And yeah, hey, I didn't even say it yet. And Dr. Nick's been doing a lot of exercises here recently, right?
Some would say.
Still going strong with the 75?
No, I've fallen off the wagon a bit. I'm not as consistent with the 2-a-day workouts as I was in the beginning.
He still works out a lot. All right, so what I'm doing right here, I'm just kind of looking at the musculature all along those rib heads there. Just kind of playing with each rib head, palpating and adding motion in them as well. So if there was like a really, really bad case of scoliosis and say there was like hypertonic tissue here, it's really locked up, we have modalities such as like dry needling, laser to really be focal to those areas to break up that tissue. But since Nick's here right now, I can show you the adjustments here. So take a nice deep breath in and all the way out. Yep. Can I actually have you just on your side facing me here?
Oh, sure.
And another thing I use is strapping as well. I don't know if you do that every once in a while for posture. With scoliosis.
In what sense?
Yeah, just like bringing the shoulders back sometimes. They're
Taping,
kind of
stuff like that?
Yeah, taping.
Yeah.
That can be a very useful
It's a
tool.
nice, yeah, a little bit of...
Good. And at least until you get into that posture and build that mind to muscle connection, I think it's very beneficial in the first few weeks there.
So a little disclaimer, you really can't fix scoliosis unless it's surgical.
Yeah.
What we can do here, go ahead.
Just a little drop, yep.
Oh, beautiful. We do really well at managing it. So managing symptoms, pain, discomfort, stuff like that. Really good at working at increasing a little bit more functionality of the spine and how well you move. So a lot of times that's the kind of, I guess, limiting factor for a lot of patients with scoliosis, that they don't move the way they want to or the way they need to. And that leads to a lot of compensation down the line, which leads to pain and discomfort in the future. So we do really well at managing pain and discomfort, but ultimately function of the spine as well.
Yeah. And mobility, exercises, core strengthening, especially with the lumbar scoliosis, is all going to be very beneficial, especially not only while you're in the office, but at home workout. So give Dr. Nick some workouts here to do at home there for scoliosis. Yeah, well, is there anything else to add there, Dr. Nick? That we do here that I'm missing? Just kind of taking a look at the musculature around that scoliosis first. Adjusting, make sure there's enough motion, possibly strapping or taping to build that mind to muscle control and add a little bit extra support. And then, yeah, strengthening the muscles surrounding it so it evens out.
No, That was good cap. I guess the biggest one, if you have any questions, concerns, don't hesitate to reach out to us. We'd be more than happy to answer some questions. And, if you're in the area, feel free to stop in. We'd love to give you a once over, see how you move, and then kind of talk about potential ways to address either your discomfort or tackle some goals you have or you want to see addressed in terms of scoliosis and whatnot.
Absolutely. And if you're far away, can't make it in the office, I'd love to see the comment section there with any questions you might have, and we'll try our best to get back to you as soon as possible.
All right, guys, thanks for watching. We look to see you in the next one.